The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. A question for the Minister of Health. Yesterday, the NSHA's Senior Director of Medical Affairs said that the Department of Health did not have a recruitment plan to pass along to the newly created Health Authority back in 2016. Seems odd, Mr. Speaker, to promise a doctor for every Nova Scotian 3 years prior without a plan for how to recruit them. So I'd like to ask the Minister, does the Minister think that 4 years is too long to wait for a plan while thousands of Nova Scotians don't have a family physician?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. As the member would know, part of the challenge I think that was being referred to is that you have a variety of different health authorities, districts within the province, different approaches to recruitment throughout the province. Bringing together a single health authority provides that opportunity to look at our province as a whole. This has resulted in a number of, I believe, improvements in identifying where needs are, how we implement, as the member mentioned, taking action with our incentives to help with recruitment, like our tuition relief program, and also our locum initiatives. Mr. Speaker, all of those initiatives taking place, and we've been learning from the experience and frontline healthcare workers to make those improvements on the ground.
The Honourable House Leader for the New Democratic Party.
Thank you, Mr. Speaker. We know 56,000 Nova Scotians are on the waiting list for a family doctor. And last spring, the minister did announce a suite of major incentives designed to encourage doctors to take patients off the waiting list, saying, Mr. Speaker, that these changes offered more choice and added incentives to practice here in Nova Scotia. However, Mr. Speaker, upon closer inspection, these incentives isn't available for physicians starting a new practice, for example. In fact, to be eligible for these incentives, physicians must have been practicing for at least 2 years or have more than 1,350 patients on their roster, Mr. Speaker. So can the minister explain why he suggested these incentives would bring more doctors, family doctors to Nova Scotia, when it excludes those at the very beginning of their career, Mr. Speaker?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for taking the opportunity to bring the suite of incentives that we announced in the spring, that we developed in collaboration with Doctors Nova Scotia, Mr. Speaker, to the floor of the House. The member is making reference to one particular incentive out of a suite of about 5 or 6 different initiatives, Mr. Speaker. The one that he's referring to was designed to encourage the expansion of existing collaborative practices and comprehensive family care being provided in the province to attach patients to a family practice. The other incentives, Mr. Speaker, that we've provided include increasing the compensation for comprehensive family care, Mr. Speaker. It's incentives like that, increasing the compensation that's available to our physicians, that's attractive not just for retaining physicians, but also recruiting new ones.